Most people believe one thing about stroke, that it happens suddenly, without warning, out of nowhere. One moment, everything is fine, and the next moment, everything changes. But this belief is dangerous because it is not always true. In many cases, the body gives signals, not hours before, not minutes before, but much earlier, days, sometimes even weeks. The problem is not that the signals are hidden. The problem is that they do not look like something serious. They are quiet, subtle, easy to ignore, and because they do not match what people expect a stroke to feel like, they are missed. A person may feel slightly weaker than usual, not enough to stop activity, just different. Another may notice that their speech feels slightly slower, not slurred, just less clear. Someone else may feel brief dizziness or instability, but it passes, and because it passes, it feels safe. But this is the mistake, because stroke does not always begin with a collapse. Sometimes it begins with instability, and instability is much harder to recognize because it feels like nothing serious until it becomes something serious. A stroke is not always a sudden event. It is often the result of a process that develops over time. Blood vessels do not suddenly fail. They change gradually. They become narrower, less flexible, more sensitive. Blood flow becomes less stable, but the body adapts. It compensates. It finds ways to keep things working, and this compensation hides the problem. At first, everything feels normal. Then small changes appear. Circulation becomes slightly less efficient. The brain receives slightly less oxygen. Not enough to cause damage, but enough to affect function. And this is when symptoms begin. Subtle ones, short ones that disappear, because the body corrects the problem temporarily. But temporary correction is not stability. It is a warning. Another important detail is repetition. These small episodes may happen more than once, but they do not always look the same. One day, dizziness. Another day, weakness. Another day, blurred vision. Because they are different, they are not connected, but they are part of the same process. The system is unstable, and instability is the stage before failure. The most dangerous symptoms are not always strong. They are the ones that feel insignificant, because insignificant symptoms are ignored. One of the most common is brief weakness. A hand may feel less controlled. A leg may feel heavier. Movement may feel slightly different. But after a few minutes, everything returns to normal, so the person forgets. Another important sign is subtle speech change. Not obvious, not dramatic, but something feels off. Words take more effort. Speech feels slower. But because the person can still speak, they ignore it. Another sign is visual disturbance, temporary blur, or difficulty focusing. Sometimes only in one eye. It lasts seconds or minutes, then disappears. Balance changes are also common. A person may feel unstable for a moment, not enough to fall, just enough to notice. But again, it passes. And because it passes, it is ignored. But the disappearance of symptoms is not safety. It is a temporary recovery. And temporary recovery is not a solution. It is a signal. One of the most dangerous thoughts a person can have is this: it passed, so it's not serious. This thought feels logical. It reduces fear. It allows a person to move on. But in reality, it can be a critical mistake. Because temporary symptoms are often warnings, not random events, not harmless episodes, but signals that something is unstable. When blood flow to the brain is briefly disrupted, the body reacts. Symptoms appear. Weakness, speech changes, dizziness. Then blood flow is restored, and symptoms disappear. This creates a false sense of safety. But nothing has been fixed. The underlying problem remains, and in many cases, it progresses. Another issue is comparison. People compare symptoms to extreme cases. They think, I didn't lose consciousness. I didn't fall. I can still move. So they assume everything is fine. But early stroke signs are not always dramatic. They are functional. They affect how the body works, not whether it works at all. And because the body still functions, the signal is ignored. But the next episode may not be temporary, and that is where the real danger begins. Stroke rarely happens without a story. There is usually a pattern, but the pattern is often invisible in real time because it unfolds slowly. A person may first notice something small, a moment of dizziness. They ignore it. Days later, they feel weakness in one arm. It lasts a few minutes, then disappears. They continue their day. Another time, they feel that speech is slightly off, but it returns to normal. So they do nothing. Each episode feels separate, unrelated, too small to matter. But together, they form a pattern of instability. Another important detail is escalation. At first, symptoms are mild. Then they become more noticeable, then more frequent. But because each episode passes, the urgency never builds. This is what makes it dangerous. Because urgency is what drives action. Without urgency, there is delay. And delay allows the process to continue. The body is showing progression, but the mind is ignoring connection. And this disconnect is where risk grows. There is no clear moment when warning becomes emergency. There is no line that says, now it is serious. The transition is silent, gradual, unnoticed. The body compensates for as long as it can. It redirects blood flow. It adjusts. It maintains function, but compensation has limits. And when those limits are reached, everything changes. Suddenly, symptoms do not disappear. Weakness stays. Speech does not recover. Balance is lost. And this feels sudden, unexpected. But it was not sudden. It was the result of everything that came before. Every ignored signal. Every delayed reaction. Every moment that felt not serious enough. The most important point is this. The body always shows the transition, but it does not announce it. It does not force you to act. It only gives you chances, and those chances become fewer over time. Many people believe that stroke only affects those who are clearly ill. But risk does not always look obvious. Some of the highest risk individuals feel almost normal. One of the main hidden risks is high blood pressure. It may not cause pain. It may not create strong symptoms, but it slowly damages blood vessels. Over time, vessels become weaker and less flexible. Another important factor is stress. Not short bursts of stress, but constant background pressure, the kind that becomes part of daily life. This affects blood pressure, circulation, and the nervous system, and over time it increases instability. Sleep is another key factor. Poor sleep reduces recovery. It affects brain function. It affects blood flow regulation. People who sleep poorly for long periods increase their risk without realizing it. Metabolic factors also play a role. Blood sugar instability, cholesterol imbalance. These do not always produce symptoms, but they affect blood vessels internally. Another important group is people with subtle signs. Occasional dizziness, brief weakness, moments of imbalance. Because these symptoms are not constant, they are ignored, but they may indicate early instability. And that is where risk begins. The difference between people who act and those who delay is awareness, not intelligence, not access. Awareness, understanding what matters, recognizing patterns, connecting small events. Many people experience early symptoms, but they do not connect them. They see each one as separate, unrelated, but awareness changes that. It turns isolated moments into a pattern, and patterns create urgency. Another important point is mindset. People often wait for certainty. They want to be sure. But certainty often comes too late. Acting early requires accepting uncertainty. It requires trusting the signal, even if it feels small, because small signals come first, and the body always shows them. The question is whether you recognize them or ignore them. When symptoms appear, The most important thing is not to analyze them, it is to act. Many people waste time trying to understand what is happening. They try to explain it, they try to wait it out. But time is critical. The brain depends on constant blood flow. And when that flow is disrupted, damage begins quickly. The first step is recognition. Sudden weakness, facial asymmetry, speech difficulty, loss of balance. These are not normal changes, even if they are brief, even if they disappear. The next step is immediate response. Do not wait. Do not assume it will pass. Do not try to rest, because delay reduces the chance of recovery. Another important point is simplicity. You do not need to be certain. You only need to recognize that something is not normal. Early action creates options. Late action limits them. This is why hesitation is dangerous, because hesitation feels safe, but it costs time. And time is the one thing the brain cannot recover. There is always a moment before something serious happens, a moment when the body gives a signal, not loud, not dramatic, but clear enough. The problem is not that the signal is weak. The problem is that it feels harmless. A slight weakness, a strange sensation, a brief change, something that passes quickly. And because it passes, it feels safe. But this is the exact moment that matters most, because at this point, nothing irreversible has happened yet. This is where everything can still be changed, but only if the signal is understood. The difference between a warning and an emergency is not always visible. It is not a clear line. It is a shift, a moment when the body can no longer compensate, and that moment feels sudden. But it is not sudden. It is the result of everything that came before, every ignored signal, every delay, every moment that felt not serious enough. And that is why timing matters more than intensity, because early signals are weak, but they are the most important. People do not ignore symptoms because they don't care. They ignore them because they don't look dangerous. They don't match expectations. They don't cause pain. They don't stop daily life. And that is why they are missed, because people are trained to react to strong signals. But the body often gives weak ones first, and weak signals are easy to dismiss, easy to explain, easy to forget. But these are the ones that come early, when action still matters. Your body is not silent. It never was. It shows you everything, but quietly, through changes, through small moments, through signals that do not interrupt your life. And that is why they are dangerous, because they do not force you to act. They only give you a chance, and that chance does not repeat forever. Because sometimes the difference between ignoring a signal and understanding it is not just health, it is life.